Healthcare is a hot-button issue across the United States, often for the same reason. Too much of the healthcare industry is willing to put profits over the comfort and well-being of the patients in their care. As a result of this unfortunate trend, trust in many healthcare companies is dropping to record lows, leaving patients and customers uncertain of who to turn to for care. Between obscure pricing and billing practices, lacking customer support, and concerns with accessibility to treatment, patients across the country are looking for a new option. Vertical Health Services, VHS, is working hard to create and become that option. VHS is a healthcare management company driven by a desire to redefine healthcare through a network of unique and supported facilities that put people first. Born out of a desire to preserve communities, ensure continuity of care, and continue to support both patients and staff in the wake of changing economic and business conditions, Vertical Health Service has taken over the management of 15 facilities across 4 states, including a new service office in Kansas City. Given the concerns felt by American patients across the country, it's no surprise that Vertical Health Services is putting a heavy priority on transparency and consistency in care. Since taking over the facilities they now manage, VHS has built their team into the cornerstone of frontline care, with an emphasis on treatment that is personal, empathetic, and tailored to the unique needs of patients and employees alike. In addition to their work, they also support a number of charitable causes and local aid organizations. When the prior company faced bankruptcy, there was a real risk of facilities closing, displacing residents, and disrupting the lives of dedicated staff, says CEO Bill Miller. This decisive action allowed residents to remain in familiar surroundings and employees to continue their work uninterrupted, laying the foundation for a company built on stability, compassion, and a commitment to high-quality care. Vertical Health Services' stated mission is to revolutionize healthcare through transparency, honesty, and consistency in care, and their operating philosophy is built around those 3 core values. By building trust through transparency, VHS fosters an environment where individuals are treated as people first and foremost, and done so with the utmost humanity and respect. This means keeping residents and families proactively informed, involved in decision-making, and respected in their wishes. In striving for honesty in every interaction, the company demonstrates its dedication to communicating openly, listening actively, and speaking truthfully about the needs, costs, and expectations for care. There will be no rude surprises. Finally, consistent, compassionate care means working with integrity and providing the same high-quality care every day, for every patient. Our dedicated team serves as the cornerstone of frontline care, profoundly impacting the lives of all our residents, Bill Miller explains. Our aim is that our residents not only receive consistent, compassionate care, but also hold our staff in the highest regard, feeling that their lives are enriched by the thoughtful and dedicated care they receive. The Vertical Health Services team has benefited from the company's focus on staff development, compliance, and high-quality care, creating a team with outstanding leadership retention and stability. As a widespread multidisciplinary company, VHS embraces the unique perspectives and experiences of each employee and resident, fostering a culture where every individual is respected, valued, and supported by equitable and inclusive opportunities. Quarterly in-person leadership orientations, education reimbursement programs, and internal CNA and CMT classes are cornerstones of internal development, and the VHS policy of promoting from within is an ongoing point of pride. We prioritize diversity, inclusion, and social responsibility by living our core values every day, explains Bill Miller. Above all, we put the person first, providing compassionate care to the elderly from all backgrounds and communities while fostering a culture where every individual, both staff and resident, is respected, valued, and supported. Vertical Health Services operates 16 facilities across the United States, 15 of them directly owned in 3 different states, and 1 managed facility in Texas. These facilities serve a wide range of healthcare needs, and are each tailored to the unique needs and characteristics of the community they serve. Since their founding, Vertical Health Services has leveraged capital improvements and implemented upgrades and modernizations across the entire collection, with investments including but not limited to new roofing, flooring, and drywall, new nursing states and call light systems, the renovation of entire wings, and the installation of new generators to ensure emergency readiness. Many of these facilities had been left wanting before VHS stepped in, and so tackling needs both new and old represented the company's first challenge. It was a significant challenge early on, said COO Andrew Eisenbrei. We set about revitalizing facilities that had been left in poor physical condition while simultaneously rebuilding trust both within each center and with external partners to create a stronger, more unified foundation for quality care and collaboration. Vertical Health Services puts the human element of healthcare first and foremost, because they believe that it's the first step in exceptional, compassionate, tailored healthcare. This extends to the employees of each location. Every facility has its own identity that's been shaped not only by the staff's clinical specialties, but the unique socio-cultural makeup of their home region. By encouraging these individualized and unique facility cultures, and the teams within them, Vertical Health Services is building a healthcare network that is empathetic and adaptable. This individualization ensures that our residents receive care that is not only outstanding but also deeply resonant with their personal backgrounds and community ties, VHS says on their website. By intertwining the expertise of our dedicated professionals with the distinctiveness of each location, we create a mosaic of care facilities that are both part of a larger, high-quality network and remarkable in their local adaptation and specialization. Vertical Health Services has, naturally, a more robust definition of success than mere financial metrics. With the goal of rewriting the rules of healthcare, nothing else would make sense. VHS measures success through a balanced platform where quality of care, regulatory compliance, and financial performance are all judged individually and as a combined whole. A multi-metric approach allows for a more holistic perspective of success, true, but that's not the goal. Vertical Health Services defines success as achieving excellence in all three simultaneously. It's a goal that the company is already consistently reaching. Since starting, VHS has made significant survey improvements reflecting their dedication to compliance and high-quality care. Their leadership retention and staff development continues to guarantee strong guidance at every level, and measurable gains have been made in quality measures, which translates directly to better outcomes for residents and patients. Additional investments in physical plant improvements have made their communities safer, more comfortable, and more pleasant overall. By focusing on this integrated approach, we ensure that our residents receive the highest standard of care, our operations meet or exceed regulatory expectations, and our organization remains financially strong and sustainable, says Bill Miller. Success, for us, is defined by achieving and maintaining this balance across every community we serve.